you have ever heard of ketamine? A few months ago, I probably would have raised my hand because I had only heard of it as some scary recreational drug. But after watching The Secret Lives of Mormon Wives, my understanding of ketamine shifted. Hearing cast members discuss their use of ketamine therapy for depression made me realize there was an entirely different side to this medication that I knew nothing about. Ketamine is emerging as a promising treatment for treatment-resistant depression, as it is addressing a clinical challenge, operating in different pathways of the brain, and showcasing encouraging results in current clinical trials. After hearing about ketamine therapy in pop culture, I was curious about the science behind this new treatment. I've done thorough research about ketamine treatments and feel fully prepared to discuss this topic. In order to better understand this new treatment, we have to take a closer look at the science behind ketamine therapy and what researchers have discovered so far. To do this, we need to understand the condition ketamine is being developed to help: treatment-resistant depression. Treatment-resistant depression has created a need for researchers to explore an alternative therapy treatment utilizing ketamine. Imagine that over the course of several months you were trying multiple different antidepressants and still finding no relief from any of them. This is a frustrating reality for millions of people living with treatment-resistant depression. Treatment-resistant depression is diagnosed when patients do not respond to previous antidepressant treatment. The FDA defines TRD as failing to respond to at least 2 antidepressants that were taken at an adequate dose and duration. Psychiatrist Dr. Roger McIntyre and colleagues, in a 2023 article published in the World Psychiatry Journal, estimate that approximately 30% of individuals with major depressive disorder meet this criteria. Continuous symptoms despite conventional treatment introduces significant clinical challenges for treating this resistant form of depression. Traditional antidepressants often do not produce sufficient remission for many patients, as it takes several weeks or months for improvement to ever be seen. Treatment-resistant depression is associated with higher healthcare costs and increased risk of suicide, demonstrating why researchers have begun exploring more innovative treatments. So, we've established why treatment-resistant depression remains a significant challenge, so now let's examine how ketamine offers a different approach to treating this condition. Ketamine stands apart from traditional antidepressants because it works through a completely different mechanism in the brain. Have you ever watched someone solve a math problem completely different from you, yet they still got the right answer and somehow did it faster? Ketamine is kind of like that. Ketamine works differently than traditional antidepressant treatments by targeting different pathways in the brain. According to neuroscientist Dr. Lisa Monagia and colleagues in a 2023 review from the Annual Review of Medicine journal, ketamine acts on the brain's glutamate system to produce antidepressant effects through a different pathway instead of targeting serotonin like traditional treatments. Ketamine promotes the formation and strengthening of new synaptic connections between the brain cells, which is believed to be contributing to its rapid speed. Ketamine therapy is carefully administered under medical supervision to maximize safety and effectiveness. According to Heather LaBruna in a 2022 Mayo Clinic article, ketamine treatment is administered either through IV infusion or as an intranasal spray known as Spravato in a doctor's office or clinic. Patients are to be kept under observation even after treatment due to temporary side effects such as dizziness, nausea, a spike in blood pressure, and even feelings of dissociation. The unique way ketamine operates in the brain has sparked significant interest among researchers for this new method of antidepressant. However, its role in mental health treatment ultimately depends on its effectiveness and safety. Current research suggests that ketamine is a promising alternative for treatment-resistant depression, but research is still crucial. So you're probably waiting for me to answer the one question that really matters here. Does this actually help people? Well, research from clinical trials has shown that ketamine can rapidly reduce the symptoms of treatment-resistant depression. According to psychiatrist Dr. Shim and colleagues in a 2026 analysis published in JAMA Psychiatry, 26 randomized clinical trials involving 1,166 patients found that ketamine significantly reduced depressive symptoms within hours of treatment and lasted for up to a week after treatment. Dr. Shim and his colleagues also found that ketamine reduced suicidal symptoms within 24 hours, suggesting this rapid relief. Ketamine requires careful medical supervision as researchers continue to evaluate its long term safety. According to the FDA, Spravato is required to be administered only in certified medical settings where patients are monitored under observation for at least 2 hours. While current research supports ketamine's short term effectiveness in depression relief, researchers clarify that its long term outcomes are still being studied, therefore, it cannot yet be fully established. As promising as ketamine appears today, its greatest impact may still be in what researchers uncover tomorrow. But for today, we explored why treatment resistant depression creates a need for alternative therapies, how ketamine works differently from traditional antidepressants, and what current research says about its effectiveness and safety. What first appeared to just be another chaotic moment on the Secret Lives of Mormon Wives actually showcased years of clinical research and innovation around ketamine, finding new hope for people living with treatment resistant depression. Thank you.